across the road and along the road, and also pedestrian crossings, people crossing the road. So, does it have intersection or curves, or is just straight? What is the intersection type? So you select one of these. Is it a roundabout? Is it formal, informal, etc.? Does it have a traffic light, the intersection flow, the intersection quality, channelization, etc.? Same thing with the intersections and curves. Then the speeds are very, very important. We need to measure the speed limit and also to measure the operating speed. In many cities, the speed limit is, for example, 50 kilometers per hour, but the operating speed is very is higher. It's not, nobody respects, even if there is a school. So we need to measure this as well. And then you are going to have something like this. This is an exercise in Cape Town, where this exercise was done in every dot point there. So we have with different colors the level of safety. So green is for 5-star, which is the best scenario, the most safe, the safest location. And then you have orange, which is 4-star. Then you have yellow, which is 3-star. And according to IRAP, this is the minimum that a school zone has to have, minimum 3-star. And then you have 2 stars with red color. And then you have the black spots with 1 star. So in this particular school, there, as you see, the primary school was here, civil primary school. Here. This is the whole school zone that you guys were talking about. This is the school zone. And then you can also measure more zones and more intersections. So you can see the level of safety in every single point. Please pay attention to this point here. As you see, there is a black spot there. That was only 1 star, the least safe part. So we proposed some interventions there. These interventions were implemented, and after this, we measured it again, and we had then a 3-star point. So this is the implementation of this particular point. Before was 1 star, very unsafe, and then the treatments were pedestrian crossing signalized and traffic calming. And this point that was a 1-star, very unsafe, it became safe with these little countermeasures. So you can do this for all the speed zones, or the school zones, measuring every single point and then proposing countermeasures to improve the situation. Then measuring again and do this benchmarking. So this is what we are doing. This is just they asked me to, in the first presentation, to show how we collect the data. And in my second presentation, I'm going to show real examples of what we have been doing. And they can also be done here in Jamaica. We are eager to do this in Jamaica, as a matter of fact. So thanks a lot. And now, Jeffrey, you will continue. Thank you so much. I stay here?
Yeah, if you want. Or no, as you like.
All right.
So, that was Julio from IRAP. So we were just in Zambia. In case you don't know where Zambia is, it's just to the north of South Africa, in southern Africa down there. And Julio and I were just in Zambia last month. And we used this tool to analyze a school area where we had put in speed bumps, sidewalks, signage. That's it, right? And it went from a 1-star school to a 5-star school for safety. And the cool thing with this is it's not us saying it's safer, it's not us thinking it's safer, it's an objective, technological, scientific measure of safety around a school area. And in your country here, I would propose that you could, Julio, how long would it take to measure the safety with this app of every school, say a primary school zone in Jamaica? 1 day per school? And how many public primary schools are there in Jamaica? How many primary schools? 900? 8 to 900? My math isn't so good, but let's say we got 5 people to go around using this app. You could have every one of these measured with before data in a month, right? And it's free. So I'm not here to sell IRAP. I'm here to sell my thing, but so we could do it. Let's do it. So amend. So I just wanted to give a little bit of an overview of the way we use science and data to inform our work. And maybe it could be interesting to implement some of what we do here. Data and science save lives. And that is a fact because you're following the facts. And I can always tell when studies in science are working, when it challenges my preconceptions. I want to think I have an idea for a program that's fantastic, and I think it's going to work. And I really believe it's going to work. And if you believe something is going to work, you're going to see reasons that it does work. But then you gather the data, and it may not work. And you have to follow the data and follow the facts to overcome your own bias. And I can tell you I'm very biased because I fall in love with program ideas, but the science keeps me sober and straight and on the right path. So the first thing we did in Africa has the world's highest road traffic injury rates. Most vulnerable, like here, are children and motorcyclists. And what the first thing we did was find baseline data. So we did a survey in a number of cities determining how children get to school, and we found that in sub-Saharan Africa, over most large cities in sub-Saharan Africa, over 85% of children walk to school. Therefore, with that data, we addressed measures to keep those road users safe. Here, it may be a slightly different mix. We're finding that a lot of kids take public transport, taxis, coasters, whatever it is. So an objective would be to determine exactly how children at specific schools get to schools and then design interventions for how they use the roads here, which here might mean installing bays for taxis and coasters, whereas in sub-Saharan Africa, it's really about the pedestrians, using the data to design your interventions appropriately. And this is relevant for some of the schools that we saw yesterday. The first thing we do when we go into a school is sit down with the kids and talk with them about how they get to school, where the neighborhoods they live in, where the traffic's coming from. It can be counterintuitive sometimes. Sometimes kids live in a neighborhood 1 kilometer down the road, and in fact they're at risk at a crossroads 800 meters from where their school is. Talk to children, gather data from them, determine where the students live to determine where the problems are. That's all very easy, simple surveys that anybody could do to get an idea of what the nature of the problems are. So the next level up is to measure for what you've done, how it's changed indicators for things like road traffic injury, right? So what we've done here is speed, as we've discussed, is an indicator for road traffic injury. So this is the school that we'll talk about later that we just improved last month in Lusaka, Zambia. And we've put in signs, we've put in speed bumps to slow vehicles down, we've separated children from traffic. And you can see that we did just using simple speed guns. I'm sure you guys have lots of speed guns to measure speed. You can see that this implementation resulted in a percentage change of over 50% reduction in speeds from around $30,000 US worth of interventions. You've gone from speeds above 30 kilometers an hour to down to 14 kilometers an hour in the areas where children are using the roads. And you can't underestimate how important that is, because it's above 30 miles an hour where you start to see the fatality rates when they're hit go up precipitously, right? So that's a way. You're not proving that this intervention has saved lives, but it's measuring the indicators. And all you need to do this is just to figure out a sample size and go out there with the speed gun and measure speeds before and after your intervention. So that's sort of the mid-level of assessment and science we use. And then the highest level, we designed a population-based randomized control trial with the U.S. Centers for Disease Control, right? This is a study that took 2 years to do. It's how drugs are tested. We chose 18 schools in Dar es Salaam, Tanzania, did this road safety intervention of putting in speed bumps, traffic calming measures at 9 of the schools, did not do it at 9 of the schools, and then we had teams gathering data in the field for months out there in the field, going door to door asking questions. And And what we found was the results of the study, and this was beyond our technical capacity. So we worked with the U.S. Centers for Disease Control to design the sample size and study design. But it was worth it because what we found was there we go, that for every 286 children whose school receives our SciSci program, which is this infrastructure program, 1 injury per year is prevented. It results in a reduction of 26% in injuries and a 58% reduction in head injuries, which means that the injuries that do still happen, are less severe than they were before, right? So this is incontrovertible proof that this method works. And this is exactly what we're hoping and thinking and talking about doing here in Jamaica. And it's not guesswork now. We can know that if we implement these measures, these simple, proven, cost-effective measures, you will get this reduction in road traffic injury. So by choosing in Jamaica, identifying, using this first phase of talking to teachers, determining where the anecdotally high road traffic injury rates are, measuring speed, you're going to get these results. So if you want to bring your road traffic injury rates down even further, following this science and these methods is the way to do it, and it will show up in your statistics in a short time. And in a country this size, with this political will that you have here, you can do it. And you can do this. Start with Julio's app. Do these implementations around the highest risk schools, and you'll see it come out in the data in the next 8 months, 18 months. It's not something that has to take years and billions of dollars. You know, we can do this today, having science lead the way forward by following the facts. That's my pitch. Selling science. So that's that.
Thank you very much, Julio and Jeffrey. See, I'm following Jeffrey now. I'm behaving like Obama. We're going to Jamaica. Back off the jacket. We are about to take lunch. I'm excited about the presentation this morning. I'm excited that we can go online and download an app from IRAP and change the risk of traveling to schools within 8 months or a year. That's excitement. That is something that we can take out of this conference and do like tomorrow morning. I'm excited that we can use science, which is the basis of all that we're supposed to do, and make a difference in this country, and not only this country, in the Caribbean. We have heard some wonderful presentations this morning, but I think some practical things that we can take out of this, and we can discuss it over lunch and going forward. And as Jeffrey says, and Julio, the policymakers are here. I mean, the Minister of Transport is here. We have the ear of the Prime Minister and other ministers and civil servants. We can do this. We can do this. So I think we have had an excellent session. Let's go to lunch. It's going to take... No, we're not at lunch yet. We're at a roundtable discussion. Or we're at lunch. Abby, guide me. Because we're at about, it's 1:45.
Feeling is probably, I don't know whether it's just me saying this, but probably a lunch now, and then to be able to go into a discussion after a couple of presentations after lunch would be, unless there's a burning couple of points that anyone wants to make immediately now before lunch.
Yesterday for lunch, Avi and I had manish water. And I hope we'll have that again today.
Manish water, it was not an afternoon you wanted to be near me or Jeffrey. You
Jeffrey, be careful.
Far away from us.
It is saying manish water is good for your daughter, so be careful. It's a Jamaican saying, and it has lots of connotations.
Should we, I think we go to
Shall
lunch
we?
and then continue the discussions after.
Right, thanks very much. Lunch, I think, Paula, lunch is served, Paula. Yes. No, it's